Hi, my name is Kasey, and I'll be your host for this week's Nurse.org Nurse Converse podcast. Everyone knows a nurse, maybe your sister, best friend, neighbor, the person you text random rash pictures to. Nurses are everywhere, practicing in a variety of specialties and healthcare settings. Nurses have been said to be the heart of healthcare, and the public called us heroes during the global pandemic. But do you truly know the nurse? In today's podcast, we will be exploring the evolution of a nurse, nursing student to seasoned professional. I'll be chatting with 3 nurses about their journey in the profession, the good, the challenging, and the funny. My first guest is Rakaya Moore, a 3rd semester nursing student with just 1 more to go before she sits for her NCLEX. She has a previous degree in public health and looks forward to specializing in women's health as a new graduate nurse. So welcome, Rakaya.
Thank you.
I'm so happy to have you here with us today.
Happy to be here.
So the first thing that I want to ask you is what brought you into nursing?
Well, if I can be 100% honest, pregnancy, work, an old memory, and a prayer.
Okay, I love that.
I know, it's a wide array of things. But the place that I was working at previously was a public health organization. It was a hospital organization or association. And I found out at the same time that I was pregnant. And the job was all related to maternal health. And so in the midst of me having that experience, being pregnant, going to work, I also had a midwife. And everything kind of came together at the same time and made me realize that I was supposed to be in nursing. And I had a flashback to this old memory of my grandmother telling me that I should be a nurse when I was about 18. I didn't want to be a nurse at that time. I thought I wanted to be in journalism, which was like totally different from healthcare. But when I really started to think about it, pray about it, think about my experience and the amazing experience I had with birth and with work and everything, I knew nursing was my calling. I knew I was supposed to be there.
Oh, that gave me chills. That literally gave me nursing is my calling. Oh my goodness. Wow. Well, we are so fortunate to have you joining the profession because that's what we need. That's what this world needs. We need more people who really truly believe in the vision of the profession.
Yeah.
So big question, and as a nurse educator, I'm super passionate about, mentoring and teaching our next generation of nurses.
Yeah.
Do you feel thus far, because I know you're only going into 3rd semester, do you feel like your nursing education thus far has prepared you for clinical practice?
Absolutely.
Yay!
Yes,
Snaps.
I do. Even though I'm not in practice yet, because that is the goal, that is where I will be. I am going to be a PCT, and I feel like my clinical experience has absolutely prepared me. Everything I've learned, my education has absolutely prepared me. I think back sometimes to when I am in clinicals or like even in starting working, and I start to do my head to toe assessments and I'm communicating with the patient and I'm thinking, oh my gosh, I've learned so much. And I'm so grateful that I've learned so much because it comes back to me when I'm with the patients. One of the things that truly sticks out to me the most is probably the spiritual and cultural aspect of that we've learned in our nursing education. Of course, all of the other pieces come together, right? You know that you have to do your clinical pieces, your assessments, those things.
Mm-hmm.
But the spiritual and the cultural parts of a person have shown me so much about how you get to know the person first before you really start to implement that care. And so I'm paying attention to, okay, this person is not just a checklist. I'm not just checking the boxes. I'm not just giving medications. I'm not just trying to do the basic things to help them, breathe or walk or any of that. But I'm considering this person as an entire person. So I'm paying attention to what do they care about? Why, what do they believe in? What do they believe that will get them out of here? What will bring their spirits up? And it really is that underlying piece that we don't see from the outside, but it's all inward. So as a nurse, just thinking about those pieces of the person and how much that matters.
Yeah, that holistic healthcare. that I think we use as a buzzword, especially like systems use as a buzzword. But what does that really look like for the individual?
Yeah.
And I think, we lose that when we're overworked and we're short staffed. And I hate the word burnout, but when we're burnt out, I think we very much can't pour from an empty cup. And I think we lose that holistic approach to patient care that really is deep rooted in the nursing profession.
Yeah.
And I do love that, your nursing school has provided you that lens, because I think that that's something you inherently have. You can't teach someone to be compassionate. You can't teach someone to be caring, and you can't teach somebody to look at that person and treat them holistically. The fact that you have that already, it just makes me believe that you're just going to soar to, I don't even know, unrealistic heights, because it's such a core part of your person.
Yeah. Thank you. And
Of
I think
course.
that so much with that respectful care, cultural competency, all of that, things that we've talked about in public health that I realize are just, like you said, deep rooted in nursing. So I take all of that, I put it all together, and I'm just thinking, yes, I have to do this for my patient. I have to consider them holistically, as you said, and really mean it.
Yeah, yes, of course. And that's the biggest thing. I can't stand fake, right? Like, you got to keep it real. And
Yeah.
people know when you are just going through a checklist
Yep.
versus actually taking a pause,
Yep.
stopping whatever you're doing, looking at that person lying in that bed and actually talking to them.
Yeah.
And I think that is what really, and you can teach anybody to do an assessment. You can teach anybody to do a med pass. It's really not that hard.
Yeah.
But you cannot teach a person to meet that person as an equal and really hear what they're saying.
Absolutely.
And, I don't even think I'm really that great of a bedside nurse. I just think that people love my presence, right? Like, I'm just authentically who I am. And I take that extra couple minutes to hear them and meet them where they are.
Yeah. That's important.
It's so important.
Which makes you a great bedside nurse.
Oh, tell me more. No, I'm just joking. That's my love language. Words of affirmation.
I got you, girl.
Oh my goodness. So my next question is about mentorship. So this could be in a formal or informal, situation. How has that played a role in your journey?
Yeah. So when I think of mentorship, it's kind of funny because I think I have a lot of like secret mentors. Like, I think people don't realize that I'm their mentee and I haven't signed a contract with you, but I am your mentee. So I hope you know that I'm just going to like really look to what you're doing. But I really value learning and just learning from people, hearing their advice on a subject matter. I'm always very reflective, always thinking about what did I do, what can I learn? And then how could I hear what somebody else told me and try to implement that in the best way. I know I had a mentor that was at my previous job, and she was a nurse. And I remember just kind of learning like evidence-based practice from her and understanding like she was a really big advocate for nurses in general. And so really understanding like, oh, this is what the nurses are doing. And so hearing that made me become a better advocate for the people I was working with, because she was telling me what was going on. Or being inspired by my midwife. To me, she's a mentor. Being inspired by my clinical lab instructors, by the people I've worked with. Just the people in my circle, I've just been really inspired by them. So I'm always paying attention, listening, hearing other people, and also realizing that mentorship doesn't mean that the person always has to be older than you, but also realizing that it's a lot about wisdom. It's a lot about what a person may have gone through in their experience that may not relate to what I've gone through. So I can see, they actually even mentioned this at my church. They mentioned that you can have a person who's younger than you, who's the same age as you, and somebody that's older than you, who should always be a mentor to you. So even in nursing school, there are a lot of people who are younger than me, but I realize the experiences that I may have had might not align with what they're going through. So I can hear them and pay attention to them and find them to be
Mm-hmm.
wise. I can find people the same age as me to be wise, and people that are older than me as well. So I think mentorship really is about the character of the person and just their wisdom. And for me, if I can see that your character is, great, and you're very wise, I'm going to pay attention to you, and I'm going to automatically think like, you have mentor capabilities. I'm going to look at some good
You're a
stuff.
sponge. You're like, I'm just going to soak it all
I'm
in.
going to soak it all in. I'm going to take it all.
Yeah.
Yeah, I mean, mentorship to me is really big, even when people don't know that I'm their mentee.
I think there's growth, right? Like everybody always thinks that it's always the mentee that's growing in that relationship, but it is such a balance.
Yeah.
And I can say I've been the mentee, I still am.
Mm-hmm.
I've been the mentor, and I've grown so much from both of those different relationships.
Yeah.
And some are more challenging than others, but I think that's really where the growth really comes in, right?
Yeah.
Is when you're challenging yourself into the uncomfortable, and that mentorship really helps you see the other side, like, oh, I can do this. Like, I've watched this person persevere through something that's been very difficult.
Yeah.
So I definitely agree. I'm a sponge too, girl, just soaking
Yeah.
it all in.
Soak it all in. Give it all to me.
So this question is going to be a tough one because I know you are a nursing student and nursing school is hard.
Yes, it is.
What has been your most challenging thus far in your journey?
Everything. No, I'm kidding.
Everything.
Most challenging thus far in nursing school has been honoring my learning style. I know that sounds crazy, right?
No, I don't think that's crazy at all.
Yeah. So, so when you go into a new field, of course, you're trying to learn from everybody. You want to, you want your cohort to come together. You want to kind of learn together. You think that you all are, that you're learning the same information. So you think that you can all learn it the same way. But I remember, I know it's not the same. I remember our academic success coach talking about this at some point and talking about our learning styles. And I attended the session and I went through the quiz and I'm thinking, okay, I'm a kinesthetic learner. I'm a reading, writing person, and I have the capabilities to do other things, but those are my two main learning, like ways of learning. But I found myself in school at some points comparing myself to other people. So somebody may say, oh, I do this thing to learn. I take all these quizzes and that helps me learn the book. And some people would say, oh, I watch a ton of videos. That helps me learn all the information. And I tried those things. But then I realized like nursing school is not a cookie cutter field. You can't just build it. Everybody can't just do the same thing. I am the Santa Claus of the cookie cutter, and they are the star of the, we're very different. So I had to realize that for me, I had to stay true to what my learning style was and remember that and stick to it. And if that meant that my time management had to look different because I couldn't listen to videos in the car because auditory is not my thing and I needed to be a reading, writing learner, then that meant that sometimes I might have to start a little bit earlier than other people. So I just had to realize I can't do what everybody else does, and that's not going to work for me. And that's okay because I'm still learning the information and I'm still retaining it, but I'm going to retain it the way that works best for me.
And what is the saying? Comparison is the theft of innovation or joy or something along those lines.
And that is all.
It drives me nuts when nursing students compare themselves to each other, to the grades. The grades. It's like, no. There are plenty of new grad positions out there for all of y'all.
Yeah.
Like, please you are only as strong as your weakest link when it comes to your classmates. Like, build each other up and get rid of that negative Nancy vibes, because that's not what you need in the real world.
Yeah. Yep.
Yes, girl.
And that put me weeks behind, so I'm glad that I stopped doing it. I had to
You're
catch
like,
up.
I'm glad that's behind me. Done. I love that in the first semester.
Yes, I really did. I was like, nope, not doing that. Doesn't work.
So what was your most rewarding?
Ooh, my most rewarding was probably a few weeks ago when I realized that to take a test, I need to stop thinking like a test taker and think like a nurse.
Okay.
It was I had to realize that it wasn't the information that I was learning and how I was learning it, or learning it incorrectly at some point, but stop trying to learn the information to anticipate the questions and to take the test in a specific way, but think about it and say, when I'm looking at a question, what would Rakaya do if the patient was satting at 92 and they had and all of that, and I had to look at it that way and then say, okay, well, I would do this first,
Right.
and if I do that first, then I know that then my next step would be to do this. And so I'm trying to think of it in the priority way, but I'm putting myself into it. And so that helped me really see how to not only take the test, but change my mindset to really be a nurse. And that actually helped my test grades go up. So that was like,
look at that. Look at God.
I was right. I was like, oh my God. Like, all I could think was, oh my gosh, because I thought like a nurse and stopped thinking like a test taker. I was able to change the narrative, and I wasn't just memorizing the information anymore. I'm thinking about, how can I apply this? So
Right.
that was probably the most rewarding thing, because I saw my test scores go up and I said, okay, I knew what the approach was. I did learn how to take a test in the sense of like learning the skills, but I also learned how to think like a nurse. And I needed to do that first to be able to see that I understood the information.
Yay.
So
Just in time for third semester.
that's what I thought too. I said, oh, this is a great time to learn this lesson.
So I know you're going to be fantastic in the future of nursing, and we're going to be so fortunate to have you join our profession. Where do you see the future of nursing, and what role do you play?
So as you mentioned in the beginning, my goal is to be a nurse in maternal health, because I do see myself growing in that role. And I definitely want to decrease the morbidity and mortality rates in maternal health. They are high in the US. And so that would definitely be a place where I would like to play a role. But also, I have been toying with the idea of doing women's health across the lifespan. So in this PCT role that I'm in, I'm going to be working with the elderly population and seeing how much they need nurses in that area. I'm really looking at not just maternal at some point, like not just that OB labor and delivery space, but at some point I want to follow my ladies into their older life. Yeah, so I think that would be a big role that I want to play there. And who knows, whatever else comes about, I might just do it. So I might be everywhere.
I love it. You're such a go-getter. You're such a go-getter.
I'm
there
a learner.
Ain't nothing wrong with that.
So sometimes that might come out. But for the future of nursing, I would like to see less burnout. I would like to see people actually enjoy their jobs and really see that like helping a patient can bring joy and have that. And there's a gratitude component there, because the care that they're taking for the patients makes them feel like they're taking care of like a friend or a family member or something. I won't always say family member because everybody doesn't like their family members, but they're taking care of someone that they love, that they really truly care about. And so I believe that when you take that approach, it brings a different joy to you than it does when you kind of go into it like, oh, another day of work. So that's where I hope that the future of nursing goes. And it's really inward than it is outward. That's kind of how I would see it.
This is fun. If you could tell your younger self one thing related to your profession, what would it be?
Listen to your grandma.
Listen, that's a good one.
She told me when I was 18. I should have done this years and years ago. No, I'd probably say to myself, don't be afraid to take the long road. Learn along the way. I've been out of college for almost 10 years. I've worked a few jobs, but along the way, I never stopped learning. My passion was always at the forefront of every job I was in, even if it wasn't related to women's health or maternal health. I was always trying to find a way to like relate it to the topic. And then I was always praying a ton and trying to figure out like, where am I supposed to be? What's my purpose? What's my calling? And so I think last year was probably the first time that I actually understood that nursing made sense to me after figuring out what is my purpose? What is my calling? What am I supposed to be doing? How did all of my other jobs relate to today? So I'm like super beyond grateful to be in school now, because it really showed me that everything that I did there was purpose to it. And it's been by far the most rewarding experience, probably since I've had my child. So
no. Thank you so much, Rakaya, for joining me today. It was a pleasure to hear your story, and I can't wait to see where you end up.
Thank you. Pleasure to be with you too.
My next guest is Michael Pratt. Michael graduated nursing school in August of 2023. He is currently employed as a new graduate nurse at a local Baltimore, Washington area hospital in the emergency department. So welcome, Michael. So let's get started. My first question for you is, what brought you into nursing?
Well, I really just wanted a job where I felt great meaning in it. I wanted a job where I could pretty much go home at the end of the day and feel good about what I was doing. And really it all kind of leads back to me thinking, what do I kind of want to think of my life as when I'm really old, and looking back to what I've done. And with all the jobs that I was doing, like I was a tree climber, I did like holiday lights for a winter and stuff. I didn't really see much fulfillment in that. I was kind of thinking, okay, like I'm probably going to hit 55 or 60 or 80 and just look back and be like, I've kind of wasted my life. I haven't helped anybody. I haven't done anything worthwhile. And I didn't really want that to happen. And nursing is so far, even just as a new grad a couple months in, it's brought me quite a bit of fulfillment. And I could say I've made a positive difference in many people's lives. So it's pretty rad. I really like that part of it.
That's awesome. That is so like self-reflective that you thought that far in advance. Like, what do I want for my life to say? Like, what impact am I going to leave? That the foresight in that is, I mean, at your age, not to put you on the spot, but at your age, like that is mind blowing, because I don't know if I've ever thought that far in advance and been like that deeply self-reflective. That's awesome. So thank you for joining us today, but also joining the profession. I feel like, you're one of those students that I can't wait to see where your future takes you. And being as that, I used to be one of your instructors. Do you feel like your nursing education prepared you for practice?
Oh, absolutely. I think I went to probably the most well-rounded and possibly one of the more difficult nursing programs in the state, and probably for a good reason. I mean, we just went over and we said that we had like an 100 NCLEX pass rate, and I think it's because like we were just trained really, really well. I had the advantage, and I didn't share this during nursing school, but I really had the advantage of kind of skating by on the GI Bill through nursing school. So I was getting the government check and going to school and focusing 100% of my efforts on it. And I just had all the time in the day, and I would just sit down and start the day. I'd study, and I'd end the day and prepare for the tests that would, the anxiety would build and build and build, and then test day would come, and the tests really closely mimic the NCLEX. And now that I'm finally in practice, I feel like a lot of the topics that we covered in the med surg classes, in the psych classes. They're all really, really applicable to the emergency department.
That's awesome to hear, because I know so many people get so caught up in, like, the test taking. It's a struggle. It's a learning curve when you're new to nursing and to this profession. Um, the fact that you can see that the knowledge you learned and were tested on, you actually used in your clinical practice. Like, I think that's everyone's goal that's in nursing education, is to say, like, you got something out of it, right? Like, you can see the difference that that struggle kind of made in your clinical practice.
Yeah, absolutely. And I'm definitely still missing a lot of like the street smart side, but I feel like my program made me like 100% prepared on the book smart side, if that makes sense.
Yeah, for sure. I mean, the goal is being a safe and competent nurse. And I think that that's really what the nursing education should focus on, is producing new graduates who are safe and competent at the bedside. I think that is literally our only job. And the street smarts, they come a time, right? Like, and in the ED, you're getting a crash course in that,
Yeah.
because you're getting patients from all walks of life. And yeah, you're seeing a lot of psych patients, probably a lot of lovingly referred to as frequent flyers, people who kind of use the emergency department as like primary care, maybe a little bit of urgent care. You're getting like a crash course in knowledge, because you're just seeing so much in such a short period of time.
Yeah, it's quick, but I kind of like it that way, where it's like, and you know, some days I'm over on the urgent care side, and I even really enjoy that because for the most part, they come in and we give them a quick treatment and we send them on their way. It's nice.
Lickety split.
Yeah.
So, how has mentorship played a role in your journey? It could be formal mentorship or informal.
So both have kind of played a pretty big role. Informal, like there's just so many leaders that have been around, both in the emergency department through education. I mean, I looked up to you, Savi and Shayna, the whole time I was in nursing school, and was just like, you know, when we first came in, and you know, you see like, you see those and people in scrubs, and you see Doctor N in scrubs and stuff like that, and you're like, okay, like eventually, I want to be that right there. Like I want to be this
Aww.
confident nurse that knows what they're doing, so much so that they're able to teach others. And so even just like the confidence and what you all brought to the table, like that right there in and of itself is just leading by example. So that right there definitely affected all of us. Um, and as far as like formal mentorship goes, my preceptor for my practicum for the ED, she I don't know if I'm able to say her name, Sarah, but
Mm-hmm.
yeah, she was very, very good at just kind of teaching me like what's up with the ED. Like, I mean, I remember my first day there. It was within probably the first 10 minutes we had a cardiac arrest come in, and
Ooh.
yeah, and I went from, you know, being like just straight up nursing student there to not really knowing what I'm doing to bagging a cardiac arrest with a Lucas on, like 0 to
Wow.
100. And she's like,
Oh
this
my
is what the
goodness.
ED is. Yeah. And I was like, this is insane. Like,
Oh
so
my gosh. Well, no
yeah,
wonder you like fell in love. Jeez,
yeah,
a whiz. That is
yeah,
really a crash course. Oh my
yeah.
goodness. That gave me
So,
chills.
but yeah, it's like, okay, this is what the ED is. Like it is, you are hanging out and everything is fine, and then all of a sudden everything goes insane and everybody
Yeah.
comes and helps out, and it's like a strong team environment.
Yeah.
So she really showed me that. She taught me the ropes, and I feel like she's still teaching me the ropes because every once in a while we'll be on the same in the same pod, and
Hmm.
she'll kind of like look over, and I'll know that there's something I'm missing. You know, there's like something that I should be doing that I'm not, and I'm like, what am I doing? You know, what am I doing wrong? You know, but yeah,
And
so
that's
definitely
so
formal and informal.
amazing. Preceptorship, like, I don't think people realize, especially nursing students, I don't think they realize how important preceptoring is, like the preceptor role, because we don't really talk about it a lot in like nursing school. And really, we don't even talk about it a lot in the nursing profession. But honestly, a preceptor is a mentor, and it can really make or break how you take on the nursing profession. the fact that you had someone that looked out for you and like gave you, the street smarts, or like provided you with that knowledge, like that is everything. It sounds like you had such a great experience, like welcoming you into the nursing profession. And that's what that like preceptor is. I've always valued my role as a preceptor. I always kind of explain it as like a safe harbor, right? It's like this non-judgmental, safe place where the learner knows that you have their back no matter what, right? And you're patient. And essentially you're a mentor, right? Like you are what that new graduate nurse is looking up to. You're a role model. And it's crazy because to be a preceptor at many institutions, you don't even need to have been there very long, right? You don't need to have met any certain qualifications or training in educating a new graduate nurse. So it's such an integral role. And I just don't think that a lot of people who do it realize the impact that they're making on new grads in general. It's crazy. It blows my mind. It's very cool.
Absolutely. And it's like a lot of that kind of stuff, even just leading by example, like even just being a strong presence on the unit, like of where everything seems chaotic and you're looking at the trackboard on Epic and you're freaking out. You're like, I've got a billion things to do right now. And then all of a sudden beside you is cool, calm, and collected, whoever. Right. And they've got a billion things to do, but they've got priority list in their head and they're just going through them. And it's like, I need to be that. I need to chill out. Got to do what I got to do.
It's crazy. In the blink of an eye, you will be that. That's really like the progression. Like you're having this conversation with me today, but in a year, you will be precepting that next new grad, making or breaking their way that they enter the nursing profession. It's kind of crazy to think about that.
It's pretty crazy. It's kind of heavy,
It is heavy. It really is. It is. But I know you're going to do amazing, obviously. But it's something to look forward to, though, right?
Yeah. Absolutely.
So far, as a new grad nurse, what has been the most challenging thus far?
There's a couple challenges. I mean, the bureaucracy of the hospital and healthcare as a system is always kind of challenging. Whenever the system is failing somebody and there's nothing, it's just like you kind of feel powerless. That can be difficult. But I mean, one thing that's kind of specific to the emergency department is whenever I do get a priority list in my head, like for example, this one guy that I had come in, he was in DKA and he had new onset AFib RVR. So he had a lot of stuff going on, and I was just like dumping stuff into this guy. Like, I mean, he was on the DILT drip. He was just given all the things, and then the orders just flying in. The intensivist is getting involved from upstairs, and then he's dropping orders as well as the ED doc. And I was super overwhelmed. And then over in the other room, there was this woman that had peed her bed. And apparently she was on the call bell the whole time that I was in this room with this guy. And she was like, hey, I need to use the bathroom. And then once I finally got him squared away, then I go into her room and you just feel really just cruddy. You're like, I know, like, I'm so sorry. Like, I literally could not make it in here. And they're pissed and they have a right to be pissed, like, I get it. And I don't feel it's right to kind of explain like, hey, like that dude over there was dying kind of thing and I couldn't make it in here. Like somebody should have had time for you. Like we should have had a tech or something that was floating around and able to come in here and help you out. But yeah, so that part's tough.
Yeah, and it's really hard when you're learning that as a new nurse that you can't be everything for everyone all the time. And that you have like this prioritized list in your head and then the shift progresses and all of a sudden you had this one finite list and now you're making all of these curves and pattern changes that you didn't really anticipate for. But I think, just being humble and just apologizing goes a long way, which I'm sure you did. but also not throwing anybody else under the bus, right? Like, that's really difficult, especially if you want to be a team player. But you're right, like, somebody else could have helped that patient, you know? So don't take it, it's not your fault. Maybe a little bit of a teamwork issue, but it happens to the best of us for sure.
Yeah.
So
And
it's
like,
called service recovery.
and it is also like on me in that regard. Like looking back, I probably should have gone to somebody and be like, "Hey, like I got this going on. Would you mind going in there and helping her out real quick?" Like I could have
Right.
done that, but
Yeah.
in the moment, I wasn't thinking of it. I was like, "Okay, this guy's gonna die. Like I need
Yeah.
to." Yeah.
Yeah. And you're human, right? You're overwhelmed. This is new. Like, that's crazy, And hopefully somebody could have recognized that as well. So when you play it back out, like, there could have been a million different scenarios. Maybe somebody would have recognized you needed help or you asking for help. I think that's important that new grads know that, sometimes us seasoned nurses, we kind of get like blinders and we're just like doing our own thing. And unless like you literally say like, hey, help over here, like we're just doing our own thing. So just kind of a reminder to the new grads out there, like ask and it will be done. So what has been the most rewarding?
I think the most rewarding is whenever we give somebody a treatment and then it fixes them. Like it just,
Aw.
yeah, it's kind of cool. Like there was this one person that came in and they were septic and altered mental status. And then after the fluid boluses, we didn't have to start like norepinephrine or anything. Fluid boluses and antibiotics. And all of a sudden they remembered, where they are. And they're like, oh, I'm at the hospital. Like I remember what today is and stuff like that. And
That's awesome.
yeah, and like I'm not sure what their outcome was, but seeing that, it's like, okay, this is kind of cool. I like doing this. Yeah.
Yeah. That's awesome. And it's nice that you get to see that because I feel like in like where I work, I don't generally get to see like such a quick recovery, with the trauma population. It takes time. A lot of time they have to go to rehab or stuff like that for them to really kind of get back to like their new normal or their new baseline. So that's awesome that you get that experience to kind of see your interventions play out and be successful. That's really cool.
Yeah, it's not every day, but I love it when it happens,
You're like, yes,
Yeah.
yes, it was a win today.
Yeah.
So where do you see the future of nursing and what role do you play?
Future of nursing, I think, I don't know, it could go so many different directions. It really could, right? I mean, we could have nurse unions and stuff where, we're banding together and people are dissatisfied with their pay, dissatisfied with their hours and the way they're treated, and people are really dissatisfied with the system.
Mm-hmm.
And so I guess like it's kind of impossible for me to predict exactly where it'll go, but I'll say at least I hope that there are changes to the system to where care is just far more accessible to people. And I know that it's not easy because primary care is just so difficult for people to access because of the shortage of physicians and primary care physicians being so burnt out, and then NPs trying to come in and relieve the stress, and there are great NPs out there, but some people don't like NPs, so then they don't go, and it's just a mess. And then it's a mess with insurance. So hopefully that gets fixed, and then as a result of that, people will just be healthier. So I think maybe that lies in the insurance companies. They're kind of the.
If you could tell your younger self one thing related to your profession, what would it be?
Do it earlier. I mean, I liked the tree climbing part of my life a little bit. I liked the lights part of my life a little bit less than that, but a little bit too. But yeah, I think that if I were to go into nursing earlier, I'd be able to do so much more. I mean, at this point, like I kind of really see myself as a baby nurse, and I'm still learning a lot. I'm not like completely competent in every situation. And I feel like I could really be more of more of where I want to be in the role, more of like a leader, more of a teacher, and like, because those are the things that I think will bring me even more kind of gratification and fulfillment, as if, like you're doing now, like teaching others and kind of raising other people in their profession. Because then it's almost like that even lives on as an extension of yourself in a way.
Yeah.
So yeah, that's kind of what I would have said. Do it earlier. Yeah.
But, I feel like there's so much value in a second degree nurse. You bring so much lived experience, and ultimately you guys make really great students and you make even better nurses. So as someone who, nursing is my second career, it comes in time, and you're so motivated that you'll be in those positions of informal leader before you know it, and the future is so bright for you. I can't wait to watch your journey kind of unfold, and I hope that you'll stay in touch and tell me all about it, because I'm like pseudo living vicariously through you and all of the new grads out there. Like, I want to know what your experiences are. I want to know the challenges. I want to know the rewarding things. Like, that fills my cup as an educator to hear those things. And I mean, lives, right? Like, you get busy, but just shoot an email, like send a text, like something. It's awesome to know where you guys are and that you're okay. Because at the end of the day, like, nurses need to be okay too. And
Yeah.
it can be hard out there sometimes.
It sure can.
So thank you so much for taking time, especially, night shifts. Oof. To talk to me, to us, and to share your story. And I will talk to you later.
I'll talk to you later. Thanks so much for having me on.
My next guest is Shayna Skeffrey, a local med-surg nurse who has been on the front lines during COVID. She is also a nurse educator at an accredited nursing school. She started as an LPN and now has an MSN in nursing education. Shayna has been a nurse for 9 years. So let's talk more to Shayna and find out how she did her nursing journey. So first, Shayna, what brought you into nursing?
Hey, so what brought me into nursing? I remember when I was younger, my godmother, actually, she passed from cancer. And I remember the drainage from the wound dressing that she had. And I remember, like, who's going to change it? What does that smell? Like, how can I help? And I realized the nurse was supposed to come and they couldn't come because of the weather. And I just was like, I can't wait to one day be that person that could actually help and like change that dressing and make that difference in her life, because I knew it would have made her feel much better. But waiting on somebody and just being that for my family would be amazing.
Wow, that's really cool. I actually didn't even know that about you. So do you feel like, from your nursing education experience, I know you started as an LPN, and then you transitioned to your RN to BSN, and then essentially your MSN. Do you feel like your nursing education prepared you for bedside practice?
I could honestly say I think my LPN prepared me more than my RN, but I think it's because when I did my LPN, it was completely brand new to me. So I felt like I had to be that sponge for my LPN. I feel like my clinical instructors and things were a lot more stricter and their expectations were a little bit higher for me. I don't know why. Maybe just because nursing was just completely new for me at that time. So I think my LPN better prepared me, but it depends on the instructor, the professor, your interest, like what really spoke out to me during that journey.
I know you've talked about how tough like LPN school is, and I think that you're right. It's like that initial fire hose moment where you are literally being thrown into this situation, and it's a new language, it's a new lifestyle. Everything about it is new, and it's so scary and can be really daunting too, right? Like,
Definitely.
you don't know what you don't know.
Mm-hmm.
So, my passion about mentorship. Do you feel like you had a mentor in your journey, whether formal or informal, that's kind of played a pivotal role into your success as a nurse?
I feel like every chapter in my journey, I had a mentor that played a different role in the different person that I was in each chapter of my life, whether it be in LPN school, being completely different. It was actually my aunt that was my mentor because as a first generation graduate of college from my family, my aunt, I was able to do things that she wasn't able to do with what she was provided with coming from a different country. So being able to live her dream and for her to support me, whether it's a good meal, food is my love language. So whether it's like a good meal before an exam or like helping me put on a blood pressure cuff at home or something like that. And then as it transitioned into the clinical aspect, I had my educator that became a huge mentor to me with the different chapters of the different things I wanted to do, like going back into nursing education. She was there for me. She helped me choose the right scholarships. Me and my anxiety, she helped me with that, like trying to calm down. And then getting into nursing education, there's amazing women that were placed in my life that really helped me navigate being a novice educator.
Yeah, I think the same. I just love the fact that our profession is predominantly women. And I know that there's some pros and cons to that, but I feel very blessed as well to have met some really powerful women from all kinds of diverse backgrounds, different stories that they've been able to share with me. And it's probably been one of the most rewarding parts of being in the nursing profession, for sure. And that includes you.
Yeah, same. I could not have done it without you. Like starting and seeing your smiling face and giving it to me real. She's a real girl.
That's for sure. So I know bedside nursing has its challenges, and we discuss this offline all the time about how hard it is right now. We make jokes about it being like the Wild West. But what do you think has been the most challenging thing that you've had to overcome in your bedside journey so far?
I think the only thing that really pops up to me now, because I guess it's still fresh. I don't care if it was 3 years ago, it's still really fresh. Throughout my 9 years, I think COVID and the pandemic was like, I still consider myself a baby nurse. I don't know why. Even like years is just time. But I think the pandemic really gave me a reality check of what nursing was and what it means to me and what it means to the care and the bedside care and the education that I am meant to provide in this world. It was scary. It caught me off guard. But it made me who I am today, that I can sit here and just talk on a podcast and just feel more confident in myself. But I saw a lot of things that I didn't want to see, but then I got to experience the love and the support that bedside nursing really does have, whether it be your mentor, whether it be your peer, your coworker, whether it be that new grad that's starting during the pandemic and you're teaching them in a different format. The pandemic really opened my eyes, gave me a different lens to nursing and how much it meant to
Yeah,
me.
I would definitely agree with you. You know, I did bedside nurse during COVID. Mine was a little bit different because my unit wasn't set up to take COVID patients at the time. And I know that you kind of got thrusted from a general med surg unit to being kind of thrusted into this new role as a COVID nurse. And COVID was so new. It blew our minds. We knew nothing about it when you think about it in scientific format. Like we really didn't know anything about it. And the fact that you didn't really actually have a say in providing care for those patients, not that you wouldn't do it, but it was really kind of thrusted upon all of us in the healthcare profession. It wasn't an option. We couldn't not go to work. We couldn't not provide care for these people. I'm
And it's
super
the
proud of
beauty of it
you.
too. It's the it's almost like I became a new grad all over again because it was just
Mm-hmm.
like, oh, this sounds interesting. I'm going to do it. I'm going to like, it's just another sick patient. It'll be fine. Everything will be fine. The world is burning, but we're great. And then it was just like, wait, someone's going down. Wait, they're no longer here. And it was just like that cycle of like emotions that come along with it. And then you have to actually deal with going home and like dealing with your family members going through things, and you leave it at the door and you walk into the hospital and you smile the best you can behind all the layers of mask and shield and just do
Yeah.
what you have to do.
I think the scariest thing was the fact of going home, right? Like I was terrified to see my mom and my stepdad because they were part of that like vulnerable population. And that was really hard for me. Like, I remember like kissing my mom one time and I was like, oh my God, did I just give my mother COVID? Because we just didn't know, right? Like we would, every other day we'd be getting notifications that a patient we were taking care of popped positive for COVID, which is a different world. I think that nursing in a post pandemic hits different. I think, we've had the luxury of seeing pre-COVID and post-COVID, and there are some things obviously systemically that needs to be fixed. But I also do agree with you that it has really brought the profession closer together.
Definitely.
And I think that's been one of the most rewarding things I've seen. So that kind of segues into the next question. What do you think in your nursing career has been the most rewarding?
In this chapter of my life, I think nursing education has been very rewarding for me in the growth that I am going through now personally, setting boundaries, loving myself, that imposter syndrome, because I always look way younger than I am. So I don't always feel like I fit in spaces that I'm placed in. And the fact that students will look me in my eye and like trust what I have to say. It's different when a patient is, they're sick and you're like, okay, this is what I learned and this is what I'm going to do. When a student looks in your eyes and they trust you, and then you go to the pinning ceremony and you watch them walk across the stage and you pin them, and you're like, you did that and you supported them do that, and then you became the mentor, like that cycle, that journey, that now you are that person that was for someone else. I think it's quite amazing. It's very rewarding. It makes me happy. I feel like I could take a deep breath after a pinning ceremony. It's my favorite part of nursing.
There's a lot of I feel like there's a lot of emotions with those pinning ceremonies. As much as you're happy to see them kind of go to the next step, there are some ones I feel like that we make these bonds with our students, and we see them as peers, and we want to work alongside them. I want to nurse with the students that we're producing, right? Like I want to have them as my colleague. I think that's so rewarding, and I long for that day that happens for me. I wish it happened more, but I would definitely say, and I think the other rewarding aspect is that first day, right? So new student orientation is always so full of emotions, and I feel like that is rewarding in its own right, because you've worked so hard to get to that point where you're about to start this journey and you have absolutely no idea what it really entails. So I would definitely agree. Pinning and student orientation definitely hit different.
That excitement in their eyes makes it all worthwhile.
It's the why.
Definitely.
Where do you see your future in nursing, and what role do you play?
So, where do I see myself in the future of nursing? I guess at this point, I've got into a doctorate program, so I'm very excited about that. I see myself teaching in the academic area, and I definitely see myself making changes. I know we spoke before about actually taking our place in helping in all the nurses associations and stuff like that. Be the change that we actually want to see. It's one thing to talk and walk, whatever. But I actually walk the walk and be like, I see this change. I'm writing about it, and I'm actually going to implement it, and I'm actually going to try to see something coming. I don't know if it's going to happen right away for the next coming years, because still growing. But there's things that I see, and being that now mentor and educator, and I still work bedside. The things that you see and you want to change and you want to support, I want to be an active person in that change. I don't want to.
So I always say, you want to be at the table, right? Like right now, I feel like in healthcare, we have people who are sitting in the boardrooms and they're making decisions for us, and they've never given a bed bath. They've never changed linens with a person who cannot help you at all. It's completely dependent upon you. I just feel like in order for us to really make a difference in the healthcare system, we need to be at the table. I think nurses need to be at the table. And unfortunately, that means being in a political realm, which is really uncomfortable for me. And I think that's what's kind of stopped me from taking that avenue, because politics definitely isn't something that I I know
Very
enough about to really
Mm-hmm.
have a valued opinion. But I think you're right. I think getting involved with the ANA, the American Nursing Association, I think that is definitely a step in the right direction for our future. I think it's up to our generation of nurses, millennials, to do that, to really, be the change and see the change that we want in our profession, for sure. So this is probably my most fun question. If you could tell your younger self one thing related to your profession, what would it be?
My younger self. Geesh. I think that's where the emotions, I was like, oh, there will be no emotions here. But my younger self going into the field, I would say you are worth it. You can make a change. You will make an impact on someone's life, and you will change. You will grow. You will love, and it'll be okay. Like everything, there's a learning experience in everything that you do. Hold your head up. Make sure your voice is heard because you matter just as much as the next person. Um, and just keep reading, keep educating yourself, keep growing, keep evolving. It's okay. That's the biggest thing. It's okay. It's okay not to be okay. It's okay if you make a mistake. Integrity and honesty and all the caring signs love. It is okay. Just keep pushing. Do not give up. That's what I would definitely tell myself. Don't curl up. Stick your chest out. You're going to be fine.
Superman pose. Or Superwoman pose.
Grey's Anatomy.
Yes. Shout out to the old school Greys.
That's the other thing. Nursing is not great at Grey's Anatomy, but it will be fun.
Yes. Yeah. No, definitely not.
No.
Thank you so much for coming. I know this, when I first told you that I was doing this, I was like, please do it. I really want you. Are you sure you want me? Is what you said. And I am so sure that I want you. I love you. I'm so very fortunate to have you in my life and to be not only a coworker and a nurse alongside Nurse Educator, and we're raising the young, and hopefully we're making a difference. And I truly believe at the end of the day we are. So thank you for coming in and talking to me as my seasoned nurse.
Seasoned, guys, seasoned. I don't know. It's so funny to be on that other aspect. It's just like, oh, I did a few years of this and a few years of that, and it's just like, oh, your experience makes you seasoned. Now I feel bad for calling all my mentors and educators seasoned because I'm like, that's just 9 years. Like, what's gonna happen when I'm 20 years in, 40 years in? They're like, what? Mm-hmm. They better not call me seasoned.
Yep. But I look forward to the nursing future, and I look forward to seeing how that looks for us all, really. So thank you so much for coming.
Thank you. Love you.
Thank you.